You've probably heard us use the term One Health to describe our center, so you might have a few questions about what it is and why it's so important to us. One Health began as an interdisciplinary response to emerging infectious diseases of animal origins. But we also find it is an ideal model for addressing the health and safety of agriculture workers.
The theme is that the health of people and the health of animals and the health of the environment are inextricably linked.
The environment, animals, and people all affect each other, so they're all part of a triangle. So One Health is just this concept of taking everything into account. So if you're working with people, you're also thinking about how do the animals or the environment affect this person. Or if you're working with animals, you think about how the people and the environment affect the animals. Or if you're working in the environment, you're looking at the animals and the people and how do those affect the environment.
And there are many other factors around contributing to this One Health idea. All of that relates to how the workers work in this industry.
For an example of how this model is applied, we can look at the response to recent changes in pork production.
In response to consumer interest in having more humane production processes, there's a move to different types of housing of sows that are producing piglets.
And now the workers have to work with a number of animals instead of just one at a time, and that can potentially have implications.
That can be potentially more dangerous to the swine worker who's having to do that. So that's a safety issue. Health issues, we're wondering if there are any difference in the air contaminants created in the two different housing systems. We know it has the potential to create respiratory hazards for workers. What are the effects on the pigs? If you were able to clean up the air better, would you get better productivity? And if you're creating more pollutants, that can get out into the environment and perhaps affect neighbors as well. So I think our project in particular has a really nice aspect where you could think about it as a One Health project as opposed to just a worker health and safety project.
As one of the core principles of UMASH, the One Health model offers a chance to understand as well as address complex emerging and existing health and safety issues in animal agriculture, using expertise from many disciplines.
Agriculture has gotten much more complex, and it changes, it's dynamic. And what health means is that we are interdisciplinary, we engage a number of key partners to really understand the issues and then to respond to those issues.
The One Health paradigm is really saying, people need to get out of their silos, they need to interact with people who might be in environmental science, who might be in human health, who might be in animal health.
When all these three groups work together, we're going to be able to study disease and figure out prevention measures a lot more easily and efficiently than if we all try to tackle these things separately.
It's exciting to see UMASH focusing on the One Health concept, and to see a center really pull it all together like UMASH has it's really good for the field.
To learn more about how One Health approaches can help improve worker safety, visit umash.umn.edu.